What is a chest X-ray and why do you need to master it? A chest X-ray is one of the most commonly used imaging tests in medicine. You will see it almost every day. It gives you a quick view of the lungs, heart, airways, bones, and diaphragm all in one image. You use it to detect pneumonia, fluid, lung collapse, heart enlargement, and fractures. If you read it well, you catch disease early. If you miss it, the diagnosis gets delayed. What is the biggest mistake beginners make? They rush. They look at the image and start guessing. No system, no structure. This is how findings get missed. You need a fixed method and you follow it every single time. Before you even look at the x ray, what should you check? Three things always: patient name, date, view type. This sounds basic, but it prevents serious errors. Imagine comparing the wrong x ray. You think the disease is getting worse when it is actually improving. That mistake starts here. What are the main chest x ray views and why do they matter? There are two main views: PA and AP. PA is the standard. The patient stands facing the detector. This gives the most accurate image. AP is used in bedridden patients. AP view can make the heart look larger than it actually is. If you forget this, you may wrongly diagnose cardiomegaly. After confirming details, what is your next step? Check image quality. Use the RIPE method. If the image is poor, your interpretation will be wrong. What does R stand for? R stands for rotation. Look at the clavicles, they should be symmetric relative to the spine. If not, the patient is rotated. This can shift structures and mimic disease. What about I? I stands for inspiration. Count the posterior ribs. You should see about 9 to 10. If you see fewer, the patient did not take a deep breath. This makes the lungs look denser and you might falsely think there is pneumonia. What does P stand for? P stands for projection. If it is a PA or AP, never judge heart size without checking this first. And E stands for exposure. Look behind the heart. You should faintly see the vertebrae. If you cannot, the image is underexposed. If it is too dark, it is overexposed. Both can hide important findings. What happens if you skip a RIPE? You base your diagnosis on a faulty image. That leads to wrong conclusions. Now the image is good. How do you read it? Use ABCDE. Same order every time. What do you check under A? You check airways under A. Look at the trachea. It should be central. If it is deviated, think carefully. Is something pulling it, like collapse, or something pushing it, like a mass of fluid? What about B? B stands for breathing, that means lungs. Compare both sides. Look for symmetry, look for opacities, look for collapse. Any difference between left and right is a clue. What do you assess under C? You assess cardiac size. In a PA view, the heart should be less than 50% of chest width. If it is more, think cardiomegaly. But remember, this rule does not apply in AP view. What comes under D? Is diaphragm. The right side is usually slightly higher. Now check the costophrenic angles. They should be sharp. If they are blunted, think of pleural effusion. And E, E stands for everything else. Check bones, check soft tissues, check devices. Many people skip this and miss key findings. What are the common findings you must recognize? Start with these five: pneumonia, white patchy areas in the lungs, pleural effusion, blunted costophrenic angle due to fluid, pneumothorax, no lung markings with a visible lung edge. Cardiomegaly is an enlarged heart shadow. Fractures, breaks in ribs or clavicles. Is one X-ray enough? The answer is no. Always compare with previous X-rays if available. This helps you see progression or improvement. What practical habits makes you better at this? Stick to one method. Do not scan randomly. Look at the whole image first, then focus on details. Correlate with symptoms. An X-ray alone is not enough. Practice with real cases. The more you see, the better you get. What should you ask when you feel stuck? Ask one simple question. What is abnormal and where exactly? If you answer that clearly, you are on the right track. Follow RIPE for quality, follow ABCDE for interpretation, stay consistent, practice daily. This is how you become confident in reading chest x rays.